Good morning, everyone. I'm Binghe XU from Cancer Hospital Chinese Academy of Medical Sciences, China. On behalf of other co-investigators, I would like to thank San Antonio Breast Cancer Symposium for inviting me to present the updated overall survival results from phase 3 PHOEBE trial of pyrotinib versus lapatinib in combination with capecitabine in patients with HER2-positive metastatic breast cancer. This slide shows my conflicts of interest. HER2 is a well-established target for treatment of HER2-positive breast cancer. In second-line setting, TDM1 after trastuzumab-based therapy is a preferred regimen recommended by international treatment guidelines. However, in some countries, TDM1 has not been approved for use in metastatic setting. Country-specific issues should be considered. Pyrotinib is a small molecule, irreversible tyrosine kinase inhibitor against EGFR, HER2, and HER4. In a previous randomized phase 2 study, we compared pyrotinib plus capecitabine versus lapatinib plus capecitabine in pre-treated patients. Both overall response rate and progression-free survival were significantly improved with pyrotinib plus capecitabine treatment. So we conducted this multi-center, open-label, randomized phase 3 study. Patients with pathologically confirmed HER2-positive metastatic breast cancer were randomized to receive either pyrotinib plus capecitabine or lapatinib plus capecitabine treatment. Patients should have received previous trastuzumab and taxanes. Up to 2 prior lines of chemotherapy for metastatic disease were also permitted. The primary endpoint was progression-free survival, as assessed by blinded independent central review. From July 2017 to October 2018, 267 patients were randomized, 134 in the pyrotinib group and 133 in the lapatinib group. Generally, baseline characteristics were well balanced between the two study groups. At the data cutoff data of an pre-specified interim analysis on March 31, 2019, the median PFS was longer in pyrotinib plus capecitabine group than in lapatinib plus capecitabine group. The hazard ratio was 0.39, and the p-value was less than 0.0001. PFS results met the criterion for statistical significance. However, overall survival data was not mature at that time. Based on this study, on July 9, 2020, China National Medical Products Administration granted full approval of pyrotinib in combination with capecitabine as second-line standard of care treatment for HER2-positive metastatic breast cancer. Here, we report the updated survival using an extended cutoff data of March 31, 2021, with a median follow-up of 33.2 months in the pyrotinib group and 31.8 months in the lapatinib group. 25 patients in pyrotinib group and 6 patients in lapatinib group were still on treatment as of data cutoff. Here are the results of updated overall survival. Median overall survival in pyrotinib group was not reached, but we observed a clear trend on overall survival benefit with pyrotinib combined treatment over lapatinib group. And the hazard ratio was 0.69. The 2 years overall survival rate was 66.6% in pyrotinib group and 58.8% in lapatinib group. Overall survival benefit with pyrotinib combined treatment was consistent observed across all predefined subgroups. Progression-free survival per investigator was also showed a consistent improvement with pyrotinib combined treatment as extending cutoff data. The median PFS per investigators was 12.5 months in the pyrotinib group and 5.6 months in the lapatinib group. The hazard ratio was 0.48. PFS in all predefined subgroups were generally consistent with the overall result. Below, Kaplan-Meier curves shows the detailed OS and PFS results in subgroups. Among patients without trastuzumab-resistant condition, the hazard ratio between pyrotinib group and lapatinib group for OS was 0.6 and for PFS was 0.44. Among trastuzumab-resistant patients, the hazard ratio for OS was 0.94 and for PFS was 0.58. In subgroups with different lines of previous chemotherapy, the benefits of pyrotinib group combined with lapatinib group were noted both for PFS and OS. In conclusion, with extended follow-up, pyrotinib plus capecitabine demonstrated a statistically significant overall survival improvement compared with lapatinib plus capecitabine in patients with HER2-positive metastatic breast cancer after trastuzumab and chemotherapy. The benefits of pyrotinib plus capecitabine were observed in most clinically relevant subgroups for both OS and PFS. This updated analysis of OS in the PHOEBE trial reaffirmed pyrotinib plus capecitabine as an established treatment option in this patients' population. Finally, I would like to thank all patients and their families, the PHOEBE study team, the SMON staff, and the San Antonio Breast Cancer Symposium Organizing Committee. Thank you very much for your attention.